Hey everyone, Dr. Paul Martin here again, Brilliant Life Chiropractic, and I've talked before about inflammation and ways to work with inflammation, and today I'm going to talk about one of the most common questions I get when someone has an injury is like, well, what should I do about it? They always ask me like, oh, should I be icing it? Or people will tell me, oh, I've been icing it, as if, that's a good thing. And this is kind of an assumption that we've been going off of lately. About ice and whether or not it's good for the body. And so I just want to outline that and maybe pick it apart a little bit and see if it really does help the body or if there's something else we can do instead. So the acronym that we've used for a long time as far as an acute injury like a sprain or something like that is RICE, RICE. And RICE stands for rest, ice, compression, and elevation. And the idea behind each of these different things is really to help reduce symptoms, help you feel better, supposedly helping the body heal. But does it really? Let's look at each one of these things, okay? So rest. Yeah, resting is good when you're injured. When tissues are traumatized, they might be damaged. Resting provides them the ability to heal, takes the stress off of them, so that kind of makes sense. Too much rest, however, can lead to immobilization of an area. Scar tissue will form a little bit too tightly, and then you can actually end up with a long-term problem or lack of mobility in that area. So even after surgeries now, doctors are putting people through physical therapy much faster than they have before, even sometimes same day, because we know that resting it too much will lead to atrophy, which is muscle wasting, and also too much scar tissue. So rest can be good, and too much is also a bad thing. So you see, the thing about scar tissue that makes it kind of interesting is that scar tissue is contractile over time. Muscle tissue can contract and then relax. Scar tissue basically just contracts, and never relaxes. And in fact, it's very hard to stretch scar tissue. It works like a zip tie. You know how zip ties work, where it goes click, 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 and then it's stuck and it can't get it off. So when tissues tear, scar tissue comes in, goes over the damaged area, and then will constantly try and pull the healthy tissue back together again, and thus that leads to healing. However, if you know the scar tissue lines up along patterns of stress. So if you never move, you don't provide those patterns of stress, and the scar tissue doesn't know how to go, so it kind of gloms on there, and then you end up with this knot of scar tissue as it keeps trying to contract in on itself, and that's a long-term injury. So rest can be good, so you don't injure yourself further, but too much will hamper healing. Give you a nice wad of scar tissue in the area that will remain tight, unstretchable, and somewhat painful because scar tissue is more highly sensitized for pain, until it gets broken up again, either re-injured or broken up with massage therapy or something. So there's that. I'm going to jump past ice and we're going to talk about compression. Compression, which means like wrapping an area and putting a little pressure on it. So if you sprain an ankle, you're swelling, and then you put some pressure on it. Why do we do this? So it restricts blood flow, and I think it actually makes it harder to heal. And now that's in an ideal scenario. So, I'll talk about that in a sec. But it seems like most of this approach, ice compression elevation, is in a move to reduce or stop the symptoms of the injury rather than allow the body to heal, as if the symptoms are the bad thing. And the symptoms are not the bad thing. The symptoms are what the body's doing to try and help it heal. So yeah, if you have swelling that is absolutely ridiculous and extreme, it could, over the long term, impede circulation and flow through the body and through an area, and that could cause a problem. But generally speaking, it's never that bad. So if you put compression on there, what that does is it takes the stress off the area somewhat so that you can still use it. Which can be very helpful for athletes if you want to get back out on the field even in the midst of an injury, or if you're in a combat situation and you just need to keep going, or maybe you're out in a trail and you hurt yourself, you sprain your ankle while you're out there. Yeah, wrap that thing up so you can get out of there. But is that the best thing to heal, or is that so that you can continue to move on an injured limb? That's what it's for. So that's really what compression is for. And that makes sense. You have to look at this stuff from a situational context. But if you're looking for the best thing for healing, I don't recommend compression necessarily. Got to look at your scenario. Elevation. Now, elevation, it would be like if you sprain your ankle and you put your leg up so that they can allow for venous return to the heart. And it can make it easier for that to happen, and can reduce swelling. So again, why do we need to do that? Why do we need to reduce swelling? Swelling is there for a reason. It actually brings blood flow to the area. It brings those cells that help chomp up the damaged bits of tissues and brings the cells that speed up the healing process. So if we reduce that blood flow, we reduce that ability. The same thing can happen in compression. We're not allowing the blood flow to get in there as much as it wants to. So, yeah, so again, I would say go off of what you feel with this one. If elevating it feels good, then I would do that. If elevating it doesn't feel good, then don't do that. Go with what feels good on that. Ice. Now I come to the big point of the video. This is about as long as my videos usually are, and here I'm just getting started with talking about ice. But so, yeah, here we go. Ice is the thing that people go like, what? When I tell them this, but when I explain it, they usually think it makes sense. So, why do we ice? Ice feels good, right? It can numb the area, which can reduce the pain. It also constricts blood vessels, which reduces blood flow, which can reduce swelling. Again, do we really want to do that? Anyway, so these are the two main things that they do, ice and other things. And that's the two main things that ice does, is it restricts the blood flow and reduces swelling, and can also reduce the sensitivity of nerves so that you don't feel pain as much. Now, why do we want to do this? Is this a good thing? Numbing nerve tissue, making you so you feel less pain, means that you might be more inclined to get up on that ankle and walk around. Consciously you might know I'm not supposed to do that, but when push comes to shove and you're like, oh, I want to go get a drink and no one's around, I guess I'll just get up on my ankle. And then you're walking in a way that you don't know what the feedback is because you've already numbed the area. So, not necessarily the best idea. And again, swelling, I've talked about swelling a little bit already. We may not want to actually do that either. Reduce swelling. The other thing that can happen with icing is you get scar tissue doesn't lay down as well. We tend not to move as much. The blood flow's not as good, so scar tissue won't lay down as well. And then that scar tissue will again sort of bleh, and then you don't get as good a healing response. So what do I suggest instead of rest ice compression elevation? What I suggest is actually heat. I like heat, even for somewhat acute injuries. Even for acute injuries, I like heat. Why do I like heat? Before I go into that, let me just say, if anything that you try that I'm recommending makes it feel worse, so if you put heat on and it feels worse, discontinue. Your body's doing enough. It doesn't need the help. But that's really why we put heat on, is that heat can help to increase blood flow. It can actually support the body in what it's trying to do, and then the body doesn't have to work quite as hard at it. It allows more of the cells to get there to do their work. It does have a slight analgesic and relaxation effect, so it can help you feel better. But the big thing that I'm trying to do when I put heat on my injuries is I'm trying to support the body in its process. The other thing that it does is it doesn't numb the nerve endings, it just sort of provides this sort of feeling. Which means when you move in a way that still hurts, it will still hurt. And that's a good thing. You want to know. And you want to move. It actually encourages you to move slightly when you feel heat. You're like, and you kind of want to move against it, right? With ice, you don't feel like you want to do that. You just want to stay stiff. It stiffens you. But with heat, you can kind of move more readily. And movement is important because it tells the scar tissue how to lay down. And then it tells healthy tissue how to repair itself. So a little bit of movement is a good thing. The idea behind all of what I'm suggesting and all I'm talking about here is that it's important to listen to the body to figure out what's going on and what is the best thing for you to do to help your injury heal. Movement is a good thing within limits. Move too far and you damage tissue. Don't move enough and your scar tissue will stay there. So you have to go with what feels right. And the body will let you know. When you're sitting on the couch, for example, and you're resting, and you get this antsy feeling, like, I don't want to stay here anymore, get up and move around. Your body is telling you, don't stay there anymore. But you'll get to a point where your body will tell you, that's enough. That's enough movement. Come back. Go back, sit down again. And then you won't feel as antsy again because you've done the movement. So that's a good thing. Now, if you're in agony, and you just think, I need this to stop, and ice sounds like the most awesome thing for you, do it. I'm not going to tell you not to do it when you're in a situation like that. Throw some ice on there if you think it will help you feel better and you're just in so much pain you cannot deal. We all have our limits. We all have our tolerances. And I don't recommend anyone just sit there and suffer. So that's what I think. Those are my thoughts. I've used these thoughts myself recovering from injury, and seems to serve me pretty well. I stay away from ice packs now, and I use heat whenever I've got something going on. If you like the video, then like the video, because it's on YouTube or Facebook. Share it with your friends if you think that's interesting, especially like sports-related people, and it'd be interesting to get their feedback. There are some studies now showing what I've been talking about as far as ice, so I find that to be validating and interesting. Started as a philosophical approach and an understanding of how the body works before it actually was backed up by studies. Chime in on the comments if you like, and if you would like to hear more about my approach to living a brilliant life, then please subscribe to my channel and follow me on Facebook. Again, this is Dr. Paul Martin with Brilliant Life Chiropractic. Remember, you deserve a brilliant life. Let it shine. Namaste.